all medicines have, risks and benefits, and cannabis is no different.
Hello, everyone. I'm Morgan, co-founder of Primal Kitchen and host of the Primal Kitchen podcast. In this episode, we're chatting with Dr. Hart, who has a decade of practice in cannabis medicine and is currently the COO of Optimind Pharma, a publicly traded company which focuses on psychedelic treatments. Furthermore, he has an academic background in nutrition and a lifelong dedication to fitness and wellness, which he integrates into his personal practice. Before we get started, a brief reminder that any and all opinions and views shared by hosts and guests on this podcast are the speaker's own and do not represent the view of Primal Kitchen or its affiliates or parent company. Hello, Dr. Hart. How are you?
I'm good. Thanks so much for having me on, Morgan.
Yeah, we're excited. We've never had any cannabis experts on this podcast, if you can believe it. So you're really filling a segment that we needed in our life. But all right, you got to rhyme for me. How did you get here as this cannabis psychedelic expert?
Sure. So, a lot of people, it actually comes back to a little bit of a personal history, and it takes me back maybe 10 or 12 years. So when I was doing my residency, I was going through emergency room rotations, and you had to be up at 4 a.m. And so I realized holy shit, I'm going to have to go to bed, so early to be able to get up in the morning. And so what happened was, I knew that, I didn't want to take any sleeping pills, and, there are a lot of dangers to sleeping pills. We can certainly chat about that if that's something you want to discuss today. But, I understood that, cannabis was something that a lot of people use for sleep. I had, used it previously, mostly recreationally up until that point. But what happened was I used it very successfully myself, and I was able to, go to bed at 7 p.m., wake up at, 3 p.m., feeling very refreshed. And the way that I was able to do that was I used cannabis. And so through my own use, I just knew that this is something that could definitely be used for sleep. And then when I started to see patients in my practice, and when they, were saying that they were having trouble sleeping, I just, wanted to tell them to another option that they may have had in addition to the ones that they were getting. And so through that, about a year after I started practicing family medicine, it became a lot easier in Canada to be able to prescribe cannabis. And so I jumped on that train right away. And I saw, so many people that I would see for, sleep disorders, whether it would be from, PTSD, which we can also talk about, or just plain insomnia or, anxiety-related insomnia. They weren't necessarily getting the relief that they were looking for with a lot of the sleeping meds. And I knew that cannabis could, in fact, be effective for those people. And then I saw in my practice that, a lot of people had excellent results. And then, one thing just led to another. And then I started exploring it for a lot more options as well. But that's how I got started. It was really that I knew that it was effective for sleep overall. And I just knew that, I had to start prescribing this instead of some of the medicines that I was prescribing.
Yeah, I mean, Ambien, you wake up and feel like a zombie. I don't know. And they're highly addictive. So I could see how that would be beneficial. So then where did it expand from there? It obviously moved beyond sleep. And what does your practice specialize in now?
So I'm a family doctor, but I do, a lot of different things. So I do ketamine therapy. I also do, cannabis therapy, like we just discussed. I do testosterone replacement therapy for men and women. But, in terms of, cannabis, the applications, I think, just kind of grew it because I didn't understand how it could be effective for so many things. I had no idea in medical school that CBD oil could be effective for people with seizures, for example, right? And so through my education, and through chatting with patients, I just learned that I had, many more applications than just for insomnia. So that developed into a lot of treating a lot of patients with chronic pain. And also too, those go hand in hand, meaning that chronic pain sometimes causes insomnia. And then also too, when people have insomnia, they just find that their pain is, less bearable the next day. So it kind of makes the chronic pain worse. So, I just understood that there was, way more applications than just sleep. And then the other thing too is that you learn a lot through your patients. So you prescribe it for someone, and they may be taking it for, say, pain, but they'll also say, even though I was taking this for pain, my sleep was actually way better, and I was in actually a way better mood the next day, and I felt like I just had less anxiety overall. So not only was I able to get rid of my sleep my sleep medication, but also my pain medication and perhaps something else as well. So, it just seems like the applications for it were, significantly growing. And even today, we still don't know we don't understand all the cannabinoids. I think as we do understand more cannabinoids, there'll probably be further applications as well.
Yeah. And you were on Joe Rogan and you debated Alex Berenson on just cannabis and its efficacy. But you said something to me before we started the podcast that I just want the audience here. You said you get as many people on cannabis as you do get off cannabis. So talk to me about that.
Sure. So, all medicines have, risks and benefits, and cannabis is no different. And I think if we want to legitimize it as a medicine, then we need to talk about the risks and we need to talk about the benefits. So, we do know that, for example, if you use, and when we say, cannabis, really talking about high THC, because CBD is in fact pretty benign overall. But if you're using high THC,
what is high THC even? What even is that?
So high THC, so tetrahydrocannabinol, that's the active compound.
Right. But what's considered high? Like 10 milligrams, 20 milligrams, I guess.
Yeah. So, I mean, there's no real medical definition for that. Like some people might say, 15% THC from flowers, but other people will say, no, it's got to be 30%, which is, ridiculously high. But, for most people, I would say they would say maybe 15 to 20% of THC is relatively high. And then I would say you came close and the nail on the head there with 10 milligrams. I think once you get beyond that, you can potentially have the bad experience if you are someone who's susceptible to paranoia and that from cannabis. So, yeah.
So which kind of people are there people that come into practice and you're like, you actually should probably quit the cannabis?
Yeah, for sure. If someone is, below the age of, 25, really when they're below the age though, of 21, 19, that's when it's really dangerous. I think if you're using cannabis at that point, you may in fact be, setting yourself up for potentially developing a mental health disorder later on in life, because, we do know that using high THC cannabis during adolescent years is not good for you. So, for those kind of people, I definitely try to steer them away from using high THC. Now, in that category, though, I do want to be clear. I do think CBD is a very effective medicine. And I think that, this also goes back even down to the age of toddlers. I do think that CBD can be effective for children, and I've seen it be effective for children. So, I just want to make that point clear. I'm talking about THC. And then also too, if people are only using high THC and they're using ridiculous amounts of cannabis, they're smoking, 5 grams a day of just high THC, then at that point you have to wonder, are they using the THC to actually treat something, or are they using the THC because they're just dependent on THC? So,
avoid other problems.
Yeah. So there's a couple different scenarios. Age is definitely one thing, and then the abuse of THC. But again, I know as I was trying to be clear earlier, but I just want to say again, CBD is not the same, and that could definitely be used safely in children. So just make that point again.
For sure. Very cool. And then you mentioned ketamine therapy. So tell everyone what ketamine therapy is.
Cool. So ketamine is something that I've been doing now for about 4 to 5 years. It helps people with a lot of different things, but mostly, again, for mental health and also for chronic pain, probably more for mental health than chronic pain, I would say. So the way I prescribe ketamine is I give it to people orally. Now, if you look at most of the studies online, most of them are or a lot of them are in patients IV, but there are more and more studies now coming out that's saying that oral ketamine is actually just as effective. So you don't necessarily have to get hooked up to an IV to get it. But ketamine often gets grouped into psychedelics, but technically it's actually not a psychedelic. It's an anesthetic, but it just seems to produce, a lot of the similar mental health benefits as some of the psychedelics do. And so I feel that's kind of the main reason why they get grouped together. And also too, you do have, a pretty big, change in your consciousness when you do take ketamine. So it is a medicine that is, going to make you feel quite different than your normal baseline state. But, the way that I prescribe for my patients is through a sublingual lozenge. So the patients would take the lozenge and then they just kind of let it dissolve in their mouth. It's not something that you swallow, so it's absorbed sublingually. And then, that medicine actually kicks in pretty quick, usually within about 5 to 10 minutes. And then it will probably reach its peak within about 15 to 20. And then what people have then is a little bit of like of a dissociative effect. So that's the best way I can describe it. Like, it's very hard to describe, like, what does a drug feel like? It's almost impossible to describe, but the way that people will describe it is a very, very dissociative. And some people kind of say that it's a little bit like a light alcohol intoxication, but the dissociation is the big thing. And then people, after about 2 to 3 hours, are mostly back to baseline. It might linger on a little bit further than that. But, after people, try the medicine, they usually feel, significantly better that day or the next day. And it has rapid effects for treating depression. So that's the main reason why I use it and how I use it.
And is it like, I had someone else on who we spoke about ketamine therapy a little bit, but it's not something you take then every day, right? Like it's...
No. So there's a lot of different ways to take it. So I do have patients that will take it at home. And then I also have patients who will take it with a psychotherapist. So, when they're with someone, they can obviously use higher doses, because when you're at home, I want my patients to be safe. So I'm only using very, very low dosages there, but still with low dosages, you can still get a pretty robust effect overall. But, the best way to do it would be to do it with therapy, because that way, you can use higher dosages, which means you can get just more of a pronounced effect from the drug itself, but also to, generally what happens is the same thing that would happen, say, if you're using, psychedelic drugs, like MDMA. You tend to just bring things up that you wouldn't otherwise like bring up before. And then that kind of makes the therapeutic session, a little bit, better overall. So some people, say that it's like, doing, psychotherapy on steroids, or, you just get much, much more benefit from the session itself.
Interesting. And then how many sessions are people like, what's normal? It's not like a long-term thing, right? It's more of like a short-term thing, or what do you do?
So for some people, they just need to do it a couple times, and, they're good maybe for 6 months, or maybe for 2 years, or maybe forever. Like, you never know. It just kind of depends upon how bad the issue is and how much they get out of the therapy itself. For other people, they may need it more as a long-term, they may need it weekly for, years. And so, for some people, they're able to get out of their trauma fairly quickly. But for some people, they're not able to get out of the trauma very quickly. And also they just keep on experiencing more and more of it. So because of that, they're kind of stuck in this, loop where they need to kind of continuously need something to kind of pick them up and get them out. So it really does depend upon the patient, but it can be used safely in the long term for sure.
Interesting. And like the best candidates for this would be who?
So people who have, tried I shouldn't say that, but it is good for these people. But for people who have tried a lot of different SSRIs or SNRIs, just different antidepressants, anti-anxiety medicines, I think they should definitely try ketamine if they've tried all those and they, haven't had any success with their other treatments. But I do want to say though, too, in addition to that I don't think you should have to try all those other medicines before you try ketamine, meaning that, like, if you are someone who is feeling down and depressed, and, I don't think you should be offered an SSRI, but I also think that you should be offered ketamine as well. I'm not
almost
saying
before. It's not like, oh, the SSRIs aren't working, you got to try ketamine first. Start
exactly.
here.
I don't think you should like have to try, two SSRIs, because generally, when I say treatment-resistant depression, the definitions for that is to try, it's either 2 or 3 drugs, for 3 months or more, and basically you get no relief from them. But, I don't think that you should have to go through that before you have to try ketamine itself. So, but again, the people who have tried everything, if you haven't tried ketamine, then you haven't tried anything, and you haven't tried everything. I meant to say, but also too, it has a different mechanism of action. Like these other drugs, SSRI, select serotonin reuptake inhibitors, they work on serotonin, right? And so ketamine is very different in the fact that it works on an NMDA receptor. So they think that that's part of the reason why people get these, robust responses when they're really depressed with ketamine. And so it does have a completely different mechanism of action than all the other antidepressants, which is why, people still get incredible results even after they've tried those drugs.
Interesting. And would you say like trauma-based individuals or like that type of depression is probably more suited? Like, is it work mostly on trauma or can it just be any kind of depression?
It can be any kind of depression.
Okay.
That's a really good question too. And like, I don't think we have the answers teased out for that with
Got
regards
it.
to like, what's better for like, is MDMA better for, a certain type of depression, psilocybin better for a certain type of depression? Like, I don't really think we have the answers on that yet, but that is something that I do want to know the answers to. And I'm kind of looking forward to what the research does say about that.
Yeah. And ketamine's been around for a while. Like, what's the side? Like, what's the risk, I guess?
Yeah, so you can go in if you have like large doses, you can go into what they call like a K-hole, which is, basically a lot of like paranoia, hallucinations, severe
Tripping out. You're just
dissociation.
tripping out
You're
in a
just
bad way.
tripping out. You're in a bad spot. You're frightened to death. Like that's the worst that can happen, which is pretty bad, right?
Yeah.
So you definitely don't want to get there. For lower doses, people may just feel a little bit like unsteady, which is probably why people sometimes compare it to like a light alcohol intoxication. But for the most part, it's mostly just like a pleasant, like dissociative effect. And actually, I should say they did a study like just a few weeks ago or maybe a couple months ago where they compared ketamine to anesthesia, and anesthesia basically produced the same results. And so some people are like, okay, well, what do you have to say about that? And I always felt that like the beneficial effect from ketamine was the dissociative effect. Like it's basically just giving your brain like a break. And so, I do think that, we do need to learn more about it. But for some people, that's kind of just what they need, is just like they just need a break from like thinking about all the trauma. And, just through giving them a break, they can really, have a tremendous therapeutic response and feel a lot better.
Interesting. I love it. Okay, I'm going back to the cannabis thing because I just haven't dug in there enough. So like, what is the main, I just feel like the like Hubermans of the world and even like Doc Omen, if you follow him, like they've really been blasting cannabis.
I know. I've seen
like
them.
Big time. So I'm just like curious what you think about that.
Sure. So like, I don't know Andrew Huberman that well. Like we exchanged a couple emails and we follow each other on Twitter, that kind of thing. And I did see his podcast with Cannabis. Some of it I thought was excellent. Some of it I thought was, maybe a little bit unfair. Like, particularly the part where he was talking about lung injuries and how it can affect, your VO2. Like there's only been a couple studies done on that, and they haven't really shown that there's been much of a detrimental effect on like your VO2 max overall. And so, I think that was one area where he maybe could have done a little bit different.
Yeah.
And then also to the longest study that we have with cannabis users using one joint a day, they actually, believe it or not, had better lung function than the other people. Right?
I remember this study. This came out like years ago, and I totally remember the study because we were like laughing about it and sending it around to our friends. I'm not like a big marijuana user, but I just thought that was ironic. Like something about maybe the inhalation was actually like training.
It does bronchodilation. So it does cause bronchodilation. So, and I have seen, I had one kid anyway where, I started him on CBD oil and his pulmonary function tests improved. And so, again, like it's hard to say whether or not it was a CBD oil, but we did initiate it like right at the time and then they did improve. So, I do think there's a couple things there that maybe he could have, it wasn't bad. It was just maybe a little bit like
alarmist
overall, a little bit alarming. And then there could have been, I think, more, discussions around CBD and some of the other non-psychoactive cannabinoids, because they are tremendously beneficial. Like CBD, it does work for a lot of different things. Like sometimes, like I was saying at the beginning of the show, like people do get off 2 to 3 different medicines just with CBD oil because it can help with pain, it can help with sleep, it can help with seizure control, it can help with the mood, it can help you feel better. So, I do think
is your company Opt Pharma that is CBD? Are you selling CBD or what are you selling in your business?
No, so Optimind Pharma, that's a publicly traded company. So that's on the Canadian Stock Exchange in Canada. So we're actually a ketamine and a psychedelic company. So we're trying to get our license to actually grow psilocybin. And so
Okay.
that's kind of what we're trying to do, is to grow psilocybin and then to use it for medicinal purposes and for scientific purposes, research purposes.
Okay. So I feel like I need to be taking CBD oil and I'm not taking it. Like, what CBD oil should I be taking? Tell me, what do I need to be doing?
So, you know, a lot of people, when they start CBD oil, they say that they feel better. And for whatever reason, people will just stop taking it for no reason.
I mean,
And so,
supplements are just hard to stay on. I mean, that's just the
I
truth.
know. It's true. It's hard to take the same thing, you know,
But if
every
you
day.
put it in a gummy format, like, I'm in for life. If I have to swallow a pill, I'm out. A liquid, I'm kind of not as good on. But if you put it in a gummy format, I'm a customer for life.
So again, I don't want to say like everyone needs to take CBD every day, like it's a vitamin or something like that. But, you know, it is something that can be taken safely every day. And for a lot of people, they do get, you know, a tremendous amount of benefit with almost like no detriment. So like, you know, should you be taking it every day? Like, you know, it may make, we haven't like chatted about this, but if you have any like aches or pains anywhere, like it may take those down a little bit. If there's any like, you know, stress going on, it may help like buffer a little bit of stress. If there's, you know, any issues with insomnia, some people find it to be helpful for insomnia, although I will say a lot of people find, you know, THC to be useful for insomnia as well. So, you know, I'm not saying that, you know, everyone should take it, but it does have, you know, a lot of uses and very few detriments to it. But in terms of like what kind to take or anything like that, like there's no one brand or anything that like I'm recommending right now per se. So I don't really have any recommendations.
Okay.
Yeah.
Got it. Can it help my heart rate variability? Should I be worried about my heart rate variability, Dr. Hart? It's terrible. It's like 19 or 20 every night.
Okay. So what measurement is that? Like
On
what's
the
that?
Aura Ring. On the Aura Ring.
Aura ring. Okay. So I do know a little bit about heart rate variability, but I don't know about like the measurement. Like when you said 19 to 20, like that didn't really
You
like
want like a higher number, like.
Yeah. No, I should say I know what it is, but I didn't know how to like quantify it based upon the 19 to 20 that you gave me. Like I've never looked into the quantity of it.
Yeah. I don't know. I just know my heart rate variability sucks. So I'm trying to figure out maybe CBD. Maybe I should try CBD and see if my heart rate variability goes up any.
I think you should. I'm
going to. I'm going to go.
Let me know how it goes.
Cool. Okay. So you also wrote a book called Friendly Fire: Why Vets Are Ditching Pills and Lighting Up to Treat PTSD. So tell me about this. This is fascinating.
Sure. So, you know, when I started prescribing cannabis, there was a lot of vets that started coming to my practice, and a lot of veterans, as we know, suffer from PTSD or post-traumatic stress disorder. You know, the stat that I continually hear in the States is that like 22 vets a day are killing themselves. And, you know, in Canada, we had more vets actually die from PTSD than in the Afghanistan war. So, you know, we know that it's a pretty big deal that it affects and that it affects the veteran population, you know, significantly more than the civilian population. And so a lot of these guys, you know, couldn't sleep at night, had severe PTSD, and they were getting treatments that just weren't working for them. So, you know, different pharmaceutical drugs, whether it was, you know, and again, I'm not saying all these drugs are bad, but whether it was trazodone or Zopiclone or, you know, any other Z drugs, or, you know, some people were even on benzodiazepines, you know, SSRIs. Again, I'm not saying that there's no place for these drugs, but, you know, when you're using, you know, a ton of them at once, sometimes it can definitely be more problematic. And so a lot of guys just weren't getting the relief that they were, you know, looking for. And then when they had tried cannabis, they had gotten the relief, you know, particularly for the anxiety and for, you know, just giving their brain like a bit of a break, you know, just like I was talking about with like the ketamine and for helping them sleep at night. And so, you know, I knew that this was something that I wanted to pursue. So I kind of joined with some other veterans, met some other veterans. And for a while I was almost not working exclusively with veterans, but I was doing, you know, most of my work was with veterans. And again, the results with cannabis were fantastic. But again, I'm saying cannabis, I'm not saying like high THC all the time. So, you know, CBD, and this is important for PTSD. So there was one study, now it was done on rats, but it showed that CBD actually decreased learned fear. And so basically that's what PTSD is. It's learned fear because, a lot of veterans, they're not just afraid to go out to like a busy bar or like a restaurant, something like that. Like they're afraid to go to like the grocery store, right? And like everyone needs to go to the grocery store to get their food to get things done, right? Unless you're living off the land somewhere in Alaska or something.
Yeah.
But most people need to go to the grocery store. So, for them not to be able to do simple tasks really affects their function. And so no one's born afraid to do that. But that's something that was learned, through life experiences and through trauma. And so when you give someone CBD, it can help reduce that learned fear and get them back to a place where, they can in fact go to, the grocery store. Now I'm making it a little bit, simpler than it is. And, sometimes you need to do, some exposure therapy in there as well, which is, far the best treatment for anxiety or PTSD, like by a landslide, is
what exposure therapy is.
Yeah, you need to expose yourself to things in order to get over it. Like if you say like, oh, I don't have PTSD or anxiety anymore because I just stay in my room all day. It's like, well, you didn't really beat anything. You didn't get over anything. You're just sort of like isolating yourself, right?
Yeah.
But what you want to do is you want to get back to being like a high functioning person. And so you need to expose yourself to the things that you're afraid to, but you just don't want to go too far. So, maybe the first time you go to the grocery store when it's like 10 p.m. at night and you take someone with you, maybe the next time you go at like, 10 o'clock at night, but you don't take someone with you. And then you just kind of eventually you get to a point where you can just go whenever you want on your own, but you do it gradually. So, through using techniques like that, and then also through using medicines like CBD and THC, you can get people back to a point where they, no longer meet the criteria for PTSD and then are just functioning normally.
So this is like a public service announcement for all of us to be doing more of the things that scare us. I feel like that's my big takeaway here, even if you don't have PTSD, don't you think?
That's right. Definitely.
Yeah, I like it.
That's the way you grow.
It's true. It's true. So I keep hammering on this, but I'm just like very curious. I have 3 boys under the age of 5. So like you talk about cannabis, like side effects in teenage boys. And I'm just like, oh my God, like I think back to my high school days, like this is terrifying. Like, do you think that we have an increase in like depression and anxiety in like, I don't know, 20, 30, 40-year-olds today because we had so many people smoking weed in their teenage years?
It's hard to say. I mean, I wouldn't say it's zero, but I wouldn't say it's like an alarming number either. But I would say that there's, everyone knows someone who smoked too much pot in high school and seemed to like never recover kind of thing. And, would that person have, been okay? Or if they didn't have the pot, like, would they have just kind of been messed up anyway? Like maybe, but I do think again, like you got to be careful with that, like, with those teenage years. And I do think that, if you do smoke it during those years, you can potentially, have an increased risk for depression or anxiety later on in life. So, to answer your question, like, yes, but I just don't know what the exact, number is. Yeah.
Yeah. And then what about like for the 40-year-old like myself, like what are your, like the people you're debating on, Joe Rogan, and what are they all saying? What's the downside? Like, what do we need to be worried about if we're not like a teenager?
So if you're, not a teenager, what you need to be worried about, what you should look at first is your family history and personal history. So, if you have schizophrenia, if you have bipolar, if you have psychosis, if you've been hospitalized, for mental health disorders, like repeatedly, like that may not be the best medicine for you.
Interesting.
Right.
Okay.
So I think you have to go through a bit of a screening process. And, I'm not against, recreational cannabis whatsoever, but if you are looking to use it medicinally, I do think the best way to do it is to talk to a doctor about it. And so, that's the way that I think it should be done if you want to use it in a medicinal manner.
Yeah. And you keep mentioning like we're talking cannabis, not just THC. So when you say that, does cannabis like include the CBD and the THC and other things? Like is cannabis a full thing or?
No, I mean, that's all like weed, pot, cannabis. It's all, I guess, could encompass the whole plant and include all the cannabinoids. Yeah.
So you think that's important? Like, don't just be isolating out the THC and putting it in a gummy with, do they do that? And then you miss all the other cannabinoids and you just have THC?
Yeah, you could get, a gummy where you're basically just getting THC, and it's okay maybe in lower doses to do that sometimes, but
But
for the
you like
most
whole plant medicine here.
whole plant for sure. And I'm a big believer of using CBD with THC, because if you use high THC all the time, you will develop a tolerance to it. But if you
Oh,
use THC with CBD, you're much, much likely less to develop a tolerance to it.
interesting.
Yeah.
That's fascinating. Why is that?
Well, so CBD it's basically an antagonist of the agonist of THC. So more or less, it's going to block some of the effects of the THC, and then also too, CBD has its own kind of rescue memory mechanisms of actions that we've identified in several studies. So it seems like it may in fact improve your memory, and so I think that when you're using THC, it's always best to use CBD as almost like a protectant.
Cool. So you would add on like a supplement, like you would, yeah. And when you're smoking weed, you're getting like the full plant, right? In most instances, I would assume.
So like you can get whole flower that's like pure THC, and you can get whole flower that's like pure CBD even, which a lot of people don't know about. You can get
Yeah.
whole flower that's like half THC, half CBD. So, you can say you're smoking the whole plant, but you could still be smoking basically just THC. So I know the wording can kind of be
Yeah,
confusing.
this is very nuanced. I had no idea. I mean, I thought it was like you just have to decide if you want to like clean your house or go to sleep. And that was like the two decisions you needed to make. But this is like a whole other thing. Is there a difference in like gummies versus smoking? Do you have a preference?
Yeah, so there's a big difference. So when you smoke, obviously it hits you like immediately, like within seconds to a minute, you're high right away, right? And then which is an advantage if you want, immediate relief from something. But the downside of that, besides the potential lung effects, is that it also leaves your body quickly. So within about 1 to 3 hours, that effect is probably going to be gone. Whereas when you use an edible, it takes maybe 30 minutes, sometimes even 1 to 2 hours for it to fully kick in. And then it's in your system for like 6 to 8 hours. So, if you're looking for like something quick, then obviously, smoking or vaping is better. But if you're looking for, something that's going to last in your system for like throughout the whole night, then that's when you would want to use an edible. And that's why an edible, would be better for helping you stay asleep. Like sure, the flower or the vape might be good for helping you get to sleep because it hits you quickly, but the edible is what's going to help you, is what's going to stay in your system all night to help you stay asleep.
Got it. That makes sense. And what about like studies on it, side effects of either? Is it kind of the same or?
So, THC obviously has, quite a few side effects, very different than CBD. So, THC in the wrong person can cause psychosis or, a schizophrenic outbreak. If you do have, family history, again, I don't think you should be using high THC. So there's some, pretty serious risks there. And even if you don't have those things in your family history, some people just get, a little bit paranoid from using too much THC.
Yeah.
CBD, very, very minimal side effects. You may feel a little bit tired if you use too much. That's really probably the biggest one. Some people report a slight headache, but overall, pretty minimal side effects with CBD.
So we should be taking it when we're taking our THC. And is it addictive or not? Like, I feel like this is another one of these like cannabis debates. Do we know?
So if you use high THC cannabis all the time, you definitely can become addicted to it and can become dependent on it. So, I believe that 100%. And I do think that if you use high THC all the time, right, I should say I know, and then you stop, you will have, some withdrawal effects where you'll feel irritable, you'll feel moody, you won't be able to sleep well at night, you're just not going to feel well in general. CBD is a lot different. They've done some studies on CBD where they've given people some pretty high doses for a while, and then they just abruptly stopped it, and then they don't get any side effects at all. So I think that THC definitely has an addictive component to it. CBD much less so though, or none at all, I should say.
I'm loving CBD. I got to tell you, after this, I'm just like, I'm sold. Okay, moving on a little bit. What trends are you seeing in the nutrition and fitness space? I know you're passionate about just health and wellness beyond psychedelics and cannabis. So I'm just curious what you're seeing out there in the nutrition and fitness space.
Well, maybe I'm just kind of locked in my own bubble a little bit, but I feel like more and more people are getting into MMA. Do you find that?
Oh, interesting. I don't know. I don't know. No, I don't find that, but I feel like I'm not in that segment.
Well, you see like Elon Musk is training now. You see
Okay, okay, fair
Whoever is
enough.
training
Yeah.
now. I've seen a couple like comedians who were on Rogan recently, like Brian Callen's training, Andrew Schultz is training. Like, seems like, and again, maybe it's just my own bubble and the people
I
that I
love it.
kind of like follow, but I find that that's kind of like blown up recently, which I think is awesome. But in maybe the nutrition side, I feel like there's a lot of discussion around Dr. Peter Attia's book Longevity. And I feel like there's a lot of discussion around cholesterol and saturated fats and fiber. Again, maybe it's me in my own bubble a little bit, but like when he put out that book Longevity, which I love, like I read it like front to back, like I studied that book and like I did see what he wrote about, the ApoB and a few other markers there that he mentioned, but I'm still sort of like figuring out my own thoughts on cholesterol overall, and they are very, very nuanced. Like it would take me, like I'm happy to like share them, but it's a subject that I feel like a lot of people are still debating right now, and people seem to be on like one side or the other.
Yeah. I would love to hear your thoughts. Also, Tia's like pretty big on like put him on statins like early, isn't he? Like early intervention with
Yeah,
statins.
I
Like
mean,
that was, that's hard for me to wrap my head around. But anyway,
yeah. So I'll give you a few things on this. I'll try to make this. This is probably going to take me 10 or 15 minutes to get through. I don't know. So I started out like I said before the show, I knew Rob Wolf, or I was on his podcast story in like 2014. So I was really on this like paleo trend in like 2010, 2011, that kind of
yeah.
thing. And I felt like, maybe we have been duped a little bit. Maybe, saturated fats don't have any, say in causing cholesterol. Maybe they don't cause, or sorry, heart disease and that kind of thing. And so I've been through that phase where I was like one of those people. I've
Like a
also
paleo
listened,
person.
yeah,
Yeah.
paleo.
Where you're like bacon, butter, bring it on, everything's fine, we're good.
Yeah, did the butter and
Yeah.
the coffee for a while thing,
Yeah.
did all that kind of stuff. So, I've been through that phase before. I also really like Lane Norton. I
Yeah.
think that
I
he's
follow
pretty,
him.
yeah, I think he's fantastic overall. I think he's one of the top guys on nutrition. And so, he is less into the, just do paleo, just be keto, and let's focus more on energy balance, calories in, calories out, and like keeping your protein intake pretty high. And I've kind of
He's
gone,
also like carb cycling too, isn't he? I mean, he's like bodybuilder type. Like people
yeah,
train with him for figure competitions and stuff, don't they?
yeah, they do. And I mean, he's a pretty big power lifter himself.
Yeah.
Like I think he goes to like world competitions and stuff. I know I'm kind of getting off topic with
No, I like this.
the cholesterol, but like what I'm trying to get is like I've been one of these people who is like hardcore paleo. Let's just do the butter, the bacon, whatever, and forget about the rest. We're going to be great because we're not eating carbs. So I've been one of those people before, and then I have looked at Lane Norton stuff a lot over the last few years, and I've looked at a lot more research, and I'm still a little bit confused on it overall because, like you're saying, it's not just Peter Attia, like we just mentioned. I've heard Kyle Gillette, who's really fantastic. He's been on Hoovman a couple times. I think he takes a statin. Kevin Bass, who I respect a lot, he takes that, but I actually think he stopped his. So I'm actually curious why he stopped his. And then, so anyways, a few people that I really respect and admire are on like the lipid lowering side. So it's hard for me to ignore that. Now, the part where I get a little bit confused though is when you look at statins, when you look at the all cause mortality and like, do people actually live longer when they take it? They don't live longer. Like when they've done these studies, the people end up living like literally like a few days longer. And so, and I know Attia's book was on longevity and then he's talking about statins, but the direct intervention of statins itself doesn't seem to produce longevity. It doesn't seem to extend life in any way. Now they'll point to, LDL, Mendelian randomization trials where, it's people with like certain genetic biomarkers have, very low LDL. And, they do, in fact, it seems like in some of these trials, do live longer with lower LDL. But the issue there is that like, that's not what these people are doing. Like, I'm not one of these people with, certain genetic predispositions that predispose me to an LDL. I'm someone with a normal predisposition that would have to take a statin to get a low LDL. So that kind of, bothers me a little bit. And then also too, there has been some evidence that shows that it can increase your risk of diabetes. Statins, again, I'm talking about. And so, that bothers me. Type 2 diabetes. So, if you look at longevity, it doesn't show that that people who take statins live longer. You may in fact increase your risk of diabetes. So, there's a couple cons there. Now, some people may say, and I don't know what the answer is to this, but some people may say, but that's just because, people who take statins are generally unhealthy anyway. And so, they're probably just going to not live as long as people who are not taking statins. Fair argument, but I don't know if that's, true or not, but it is something that we do have to kind of like tease out. And then there was another study that I actually tweeted out recently where it showed that people who had the highest total cholesterol and LDL actually lived longer, and they even said in the conclusions, like paradoxically, like the people, in the top 10% of cholesterol live longer than the people in the bottom 90% of, however they kind of phrased it. So, it is a very, very strange, subject overall. Yeah. And so, where does that leave me and what am I doing? So like, I'm not on a statin, but I do try to, limit-ish my saturated fat intake. So, I'll have like 4 eggs in a day, like that's fine. But, I'll eat like more like leaner cuts of beef. I get more, say like, strip loins or sirloin, say over, like a ribeye or filet, that kind of thing. And I do have about 25 grams of psyllium husk fiber per day. And so I am trying to, lower my cholesterol to a certain level, but I don't want to, I'm not in the camp quite yet of like, I'm just going to do whatever I can to get my LDL down. And I'm not like, again, maybe I'll change my mind soon, but I'm not ready now to take a statin either.
Yeah.
Like I'm just not right now.
Yeah.
So we'll see.
Well, it's like, are we majoring in the minors here? Like maybe it sounds like if we don't even know, like we're all worried about this cholesterol thing, is that even like the thing we should be worried about, perhaps?
Yeah. I mean, I did see a study recently that showed that we should be actually worried about CRP more than cholesterol. So C-reactive protein, which is an excellent marker if you're doing your blood work for overall inflammation. I order it on my patients like basically all the time, every time I do blood work.
Yeah.
So that's something that's been shown to be high correlated with heart disease. And then just the other basic things as well, like is your blood pressure well controlled?
Yeah.
Is your waist circumference low and your BMI, when I say low, like in a healthy range? Do you have a decent amount of muscle mass? Are you exercising? Exercise, probably should have said that first, is probably the biggest thing. So, there are, that's a good point. Like cholesterol is just one risk factor for cardiovascular disease. So
it is a hot one though. So when CRP comes back high, what do you do with people?
So it's a good question. I usually actually tell them to take curcumin because I have seen some studies that have shown that curcumin can decrease CRP, and I've seen it in my practice as well. So there's unfortunately no like pharmaceutical drug out there that I'm aware of that is prescribed for patients to lower CRP. But curcumin. I'm not sure too. I almost want to check right now while we're doing this if CoQ10 does. I'm not sure if it does, but it might. So
I think it does. I feel like it does.
Kind of look.
CoQ10's like one. I see. That's one. Talk about supplements you start and then don't stay on. For my migraines, that's like a big one. But
migraines though, that's what cannabis is incredible for.
Oh, really? But I've been pregnant or breastfeeding. Are you ready for this? For 5.5 years straight. So
holy shit.
Yeah.
You've been busy.
I've been busy. So I haven't been able to do any cannabis in my life, but I feel like I'm getting there. I'm close. Like
You know, there are cannabinoids in breast milk.
there are.
Yeah, there are cannabinoids in
So
breast milk.
would you be worried about taking cannabis though when you're breastfeeding?
I mean, I don't advise people to take cannabis when they're breastfeeding, but there are natural cannabinoids in breast milk, which is just kind of
Interesting.
interesting.
Yeah,
Yeah,
that is interesting.
yeah.
You know what a supplement I'm obsessed with is monolaurin. That's also, I think, in breast milk. But whenever I get sick, I just pop these monolaurin 3 in the morning, 3 at night. I think it's like another thing that's in breast milk. And I swear, like if it's a virus, like my whole family got the flu, I didn't get sick. And I have like,
Very interesting.
yeah, you got to look into
What's
monolaurin.
that?
I don't know. It's in breast milk, monolaurin. Look it up. Maybe it's kind of like a classroom type thing, but a doctor in LA once told me about it for like flu season, and I'm like swearing by it. I'm a bit of a supplement junkie, so
I
I
take
like.
a few supplements too, so
What do
I'm
you
right
take?
there with
What are you doing over there? What are you eating these days? Are you more on the carnivore trend now? Obviously not if you're having all this fiber. Or where are you on the diet these days?
Sure. You know what? I feel like it's almost best if I just tell you exactly what I eat and
Yeah,
the rest
yeah. I
of
want to
it
hear that.
because I don't have like I'm not following like a diet. I'm
No,
just
no. I want to hear exactly a day in the life. What are you eating?
sure. So I'm someone who I don't really build muscle particularly easily. So for myself, I don't do too much intermittent fasting. I actually find it really easy to do, like to go 16 hours without eating. But
Me too.
um, so I almost have to like force myself to have something in the morning. So generally in the morning, I'll have a protein shake. And when I mean a protein shake, I mean literally just a scoop of whey protein with a little bit of psyllium husk fiber, and that's it. Just to start
And some
off.
water or almond milk or something.
No, just in water, just in water.
Okay.
Yeah.
Primal Kitchen
And then
has the best tasting whey protein. So I'm going to send you some. Just FYI, you need to have it in your life. It's so good.
dope. Well, I'm looking forward to trying that. But also too, I should just maybe say when I get up in the morning, I do crush a element pack of salt
Yeah.
usually every morning, and then I get my 5 minutes of sun, and then I kind of delay my coffee then for about an hour, maybe to an hour and a half, at least an hour. And then I just have black coffee in the morning. So just one coffee to start. And then what I do is I put like 4 shots, although it's half caffeinated, in my thermos, and I just kind of sip on that all day, and I stop around 2. But I'll get back to my diet, but that's still kind of part of my diet, the coffee.
Yeah.
So lunch, I usually have 4 eggs every single day.
Okay.
And then with the eggs, sometimes there's some leftover chili like there was today. So I'll have a little bit of that. I'll throw that in there with it. And then sometimes in addition to that, I'll have like a scoop of greens powder. Well, the one I'm using now is by ATP Labs. And then I might throw in some extra spirulina in there. And then I'll have some fiber again. And then like I said, if I don't feel like I'm getting quite enough protein, then I'll top it up with a little bit more whey protein. And that's kind of what I do, for most of the.
Are you just doing eggs over easy, like fried in butter? Or are you doing hard boiled eggs?
So I take the smallest amount of butter just to coat the pan, and then I just scramble them every time. Yeah. And that works for me. Sometimes I use a little bit of salsa as well to kind of give a little bit of flavor. And then that takes me up basically until I usually work out. So I usually work out after work. So usually sometime between 5 to 7 o'clock. And then before I work out, sometimes I might need, something to kind of get me going. So I might have a little bit of like a protein bar or something like that. But a lot of times I don't have anything. And then after I work out, I'll have 2, sometimes even 3 scoops of whey protein. And then I have a ton of berries in a shake with it. I put some sauerkraut in there as well. And then I'll put in usually a zucchini or cucumber, a couple different vegetables with that. And then after that, that's kind of when I have like my main, like massive meal. So an hour or so after my shake, I'll have like sometimes like a pound of like beef, like of just like chili, something like that. For example, like that's what I had the other night. And then I'll have some potatoes or some rice with it. So I might have like 2 full potatoes, or I might have like, several cups of rice. Like I need the carbohydrates to kind of keep weight on me. Like I said, like I would probably wouldn't say like I'm a hard gainer, but for me to maintain like 200 pounds, I'm around 6'1", I need to like just shove like the food into me, or I just won't be able to maintain. So yeah, I usually have the potatoes or rice with it. And potatoes actually, I know sometimes people demonize them, and you probably know this, but they're the number one food on the satiety index. So meaning that's the food
Interesting.
that'll make you feel the most full.
White potatoes and sweet potatoes, or just white potatoes?
I saw white potatoes, but that's a really good question. I imagine sweet potatoes would be right up there too.
Yeah,
Like
we
just
really
delicious.
vilified potatoes in the paleo space. Mark he reversed on that like pretty early.
Yeah,
And
I
like
think so too.
potatoes that are cooked and cooled, you have a huge source of resistant starch. Like, I mean, there's a lot of benefit there. And I had no idea about the satiety. So that's super interesting. Love it.
Yeah, and sometimes too, like if I do have bread at all, like if I have like a burger at night, I'll use like gluten-free sourdough bread. And, it's not quite the same, I guess, as like, having just a general sort of like, burger buns, but they still do the job and they're still pretty tasty.
Cool.
Yeah.
I love it. And what supplements, like what are your favorite supplements you're taking these days? What do you take?
Favorite supplements. So obviously whey protein is, just a staple of mine. Creatine is another big staple of mine. Fish oil is another big staple. In terms of other ones, everything else I kind of like fluctuate with a bit. But lately there's a supplement City Choline that I've been using. I think that's been
Is that like a phosphatidylcholine type thing?
Yes. So it's basically supposed to help with like memory, verbal fluency, that kind of thing. And I think it does have an effect. And it does have an effect. I've seen a couple studies where it has a beneficial effect in healthy volunteers. Whereas like a lot of the supplements, like I think like acetylcarnitine, for example, I mean, maybe there's a new one out, but I think that's only been shown to like slow like dementia in like older adults, or maybe restore some cognitive impairment to older adults. But what you want to look for is the stuff that like, improves healthy functioning adults. So like, City Choline is one that I've tried recently. I found that to be pretty helpful overall. Yeah, I'm kind of a little bit boring there with that right now.
No, I love it. That's great. Creatine, I feel like, is really having a moment. I just feel like creatine was like something the football players took when I was in high school, and now like everybody's taking creatine. But it's got a lot of like neuroprotective benefits and whatnot.
Absolutely. I mean, I think every senior should be taking creatine. Like, there's almost no reason not to take it. Like, it's going to help you retain your muscle mass. It's going to help give you a little bit more energy. So you're going to be able to do more. So you're going to be able to exercise more, which is, very beneficial there in and of itself. Also, it's great for slowing cognitive decline, like you were just mentioning. So, and it's very, very safe. Like, it's all like bullshit about it, like being hard on your kidneys or anything like that. Like if you're just taking like 5 grams of creatine a day, very, very safe supplement. And like you just said, it's not just for like football players or bodybuilders. It's for like your mom, it's for your dad, it's for your grandma. Like it's for everyone.
I love it. This was awesome. Okay. Thank you so much. We're almost out of town. I have one last question I ask everyone, but what is something most people don't know about you?
Well, I think the people who know me obviously know where I'm from, but a lot of people don't know that I'm from St. John's, Newfoundland. So
I would not have guessed that.
Yeah. So it's an island on the east coast of Canada. But what else? Okay. One other thing maybe that you wouldn't think. I almost only listen to rap music, which makes no sense because I'm from like the whitest place in the world, like I just described. Yeah. And I'm almost a 40-year-old white dude. And it's still the only thing that I listen to. But I love it. But a lot of people still, I think, are in the same boat. Like they thought that like, oh, when I'm like older, I'll like grow out of this kind of thing. But now it's just kind of become like adult music, which is kind of interesting.
This is great. I love it. Thank you so much. This was awesome. Can you let everyone know where they can find you personally and anything else you want to let them know?
Sure. Great. So I have my own podcast called the Heart to Heart Podcast, and you can find me on Twitter, on Instagram, on Facebook. It's all at Dr. Mike Hart. So DrMikeHart. And Morgan, thank you so much for having me on. I've had a great time chatting with you.
Yeah, this was awesome. Thanks so much.